Hello guys, my name is Manuel Bill. Today I'm here with something different. So over the past few days or weeks, I have been coming up with questions for nurses that pertains to some particular exams. Today the team has gathered pharmacology NCLEX RN questions that are likely to come into your NCLEX exam. These have been researched and the team put a whole lot of effort in gathering all these questions for you. You are going to get closely 80 to 90% of all your pharmacology NCLEX questions coming from these set of questions. You just have to watch up to the end if you are coming to write your NCLEX RN test. Make sure that you go through this video multiple times to get all that you need to pass your NCLEX exams. I'll be coming with similar NCLEX related topics that we have to cover before you write your NCLEX exam. Note that this video once again is proudly sponsored by American Dream NCLEX Prep. We thank you guys so much for sponsoring us in all these videos we've been producing this month. Contact them if you want to write your NCLEX. They will make sure they do your CGFNS registration, your WES registration for you, and they also take care of all board registration, and they make sure that you get into a class where you discuss all these topics that you will need to pass or to ace your NCLEX exam at a go. I'll leave their link in the description and just contact them and they'll get back to you. Without wasting much time, let's look at these 100 pharmacology questions that are likely to appear in your NCLEX exams. Don't forget to subscribe to the channel and like all our videos.
A client with a history of hypertension is prescribed lisinopril. Which of the following adverse effects should the nurse monitor for? A. Hyperkalemia. B. Hypertension. C. Hypoglycemia. D. Bradycardia. It's A. Hyperkalemia. Lisinopril, an ACE inhibitor, can increase potassium levels, leading to hyperkalemia. Clients on ACE inhibitors should have their potassium levels monitored regularly. A client is taking warfarin, Coumadin. The nurse instructs the client to avoid which of the following foods? A. Eat bananas. B. Spinach. C. Chicken. D. Apples. It's B. Spinach. Spinach is high in vitamin K, which can counteract the effects of warfarin and decrease its effectiveness. A client receiving digoxin, Lanoxin, is at risk for digoxin toxicity. Which of the following is an early sign of digoxin toxicity? A. Constipation. B. Hypertension. C. Visual disturbances. D. Increased appetite. It's C. Visual disturbances. Visual disturbances, such as seeing halos or yellow-green tinges, are early signs of digoxin toxicity. A nurse is administering a beta blocker to a client. Which of the following conditions would make the nurse question this order? A. Asthma. B. Hypertension. C. Atrial fibrillation. D. Heart failure. It's A. Asthma. Beta blockers can cause bronchoconstriction, which may exacerbate asthma symptoms. A client is prescribed furosemide, Lasix. Which electrolyte imbalance is most likely to occur? A. Hypernatremia. B. Hyperkalemia. C. Hypercalcemia. D. Hypokalemia. It's D. Hypokalemia. Furosemide is a loop diuretic that can lead to significant potassium loss, resulting in hypokalemia. A client who is taking lithium carbonate for bipolar disorder should avoid which of the following? A. Low sodium diet. B. High calcium diet. C. High protein diet. D. High fiber diet. It's A. Low sodium diet. A low sodium diet can increase lithium reabsorption in the kidneys, leading to lithium toxicity. A nurse is educating a client on the use of sublingual nitroglycerin. Which statement by the client indicates a need for further teaching? A. I can take the medication after eating a large meal. B. I should sit down when I take this medication. C. I can take up to 3 tablets 5 minutes apart. D. I should keep the tablets in a cool, dry place. It's A. I can take the medication after eating a large meal. Sublingual nitroglycerin should be taken on an empty stomach for better absorption. Taking it after a large meal may reduce its effectiveness. A client is prescribed amoxicillin for a bacterial infection. The client reports a history of a severe allergic reaction to penicillin. The nurse should A. Hold the medication and notify the healthcare provider. B. Administer the medication and monitor for adverse reactions. C. Administer the medication after pre-medicating with an antihistamine. D. Give half the prescribed dose to minimize the risk of reaction. It's A. Hold the medication and notify the healthcare provider. Amoxicillin is a penicillin antibiotic, and a severe allergic reaction to penicillin is a contraindication for its use. A client is taking levothyroxine, Synthroid, for hypothyroidism. The nurse should teach the client to take the medication A. With food, B. At bedtime, C. On an empty stomach in the morning, D. With a calcium supplement. It's C. On an empty stomach in the morning. Levothyroxine should be taken on an empty stomach in the morning for optimal absorption. A client receiving heparin therapy is at risk for bleeding. Which laboratory test should be monitored? A. Prothrombin time, PT. B. International Normalized Ratio, INR. C. Platelet count. D. Partial thromboplastin time. It's D. Partial thromboplastin time, PTT. PTT is used to monitor heparin therapy to ensure therapeutic levels and prevent bleeding complications. A client with type 2 diabetes is prescribed metformin. Which of the following should the nurse monitor closely? A. Liver function tests. B. Serum creatinine. C. Blood pressure. D. Electrolytes. It's B. Serum creatinine. Metformin is contraindicated in clients with renal impairment because it can cause lactic acidosis. Client is prescribed phenytoin, Dilantin, for seizure control. Which statement by the client indicates a need for further education? A. I will brush my teeth regularly to prevent gum issues. B. I can stop taking the medication when my seizures are controlled. C. I will have regular blood tests to monitor the drug level. D. I should avoid drinking alcohol while taking this medication. It's B. I can stop taking the medication when my seizures are controlled. Phenytoin should not be stopped abruptly, as this can lead to withdrawal seizures. It should be tapered under medical supervision. A client taking atorvastatin, Lipitor, reports muscle pain and weakness. The nurse should recognize these symptoms as possible signs of A. Rhabdomyolysis, B. Hepatotoxicity, C. Pancreatitis, D. Hyperglycemia. It's A. Rhabdomyolysis. Muscle pain and weakness can be signs of rhabdomyolysis, a serious side effect of statins that requires immediate attention. A nurse is administering insulin Lispro, Humalog, to a client with diabetes. The nurse should ensure the client eats within the time frame. A. 30 minutes, B. 1 hour, C. 2 hours, D. 15 minutes. It's D. 15 minutes. Insulin Lispro is a rapid-acting insulin that begins to work within 15 minutes, so the client should eat shortly after administration to prevent hypoglycemia. A client is prescribed spironolactone, aldactone. Which dietary instruction should the nurse provide? A. Decrease sodium intake. B. Increase potassium intake. C. Increase calcium intake. D. Avoid high-fat foods. It's A. Decrease sodium intake. Spironolactone is a potassium-sparing diuretic, and while potassium levels should be monitored, sodium intake should be reduced to prevent fluid retention and hypertension. A client with chronic pain is prescribed morphine sulfate. Which assessment is most critical? A. Respiratory rate. B. Heart rate. C. Blood pressure. D. Temperature. It's A. Respiratory rate. Morphine can depress the respiratory center in the brain, leading to respiratory depression, which is a life-threatening condition. A nurse is preparing to administer albuterol via a nebulizer. Which of the following side effects should the nurse monitor for? A. Tachycardia. B. Bradycardia. C. Hypotension. D. Diarrhea. It's A. Tachycardia. Albuterol can cause tachycardia as a side effect due to its beta-adrenergic stimulating effects. A client is receiving vancomycin for a severe infection. The nurse should monitor the client for which of the following? A. Hypertension. B. Hypoglycemia. C. Nephrotoxicity. D. Hypernatremia. It's C. Nephrotoxicity. Vancomycin can be nephrotoxic, and renal function should be closely monitored during therapy. A client taking prednisone for chronic asthma is at risk for developing which condition? A. Hyponatremia. B. Hyperkalemia. C. Hyperthyroidism. D. Osteoporosis. It's D. Osteoporosis. Long-term use of corticosteroids like prednisone can lead to bone demineralization and osteoporosis. A client with a history of heart failure is started on digoxin. Which electrolyte imbalance increases the risk of digoxin toxicity? A. Hypercalcemia. B. Hypokalemia. C. Hypomagnesemia. D. Hypernatremia. It's B. Hypokalemia. Hypokalemia increases the risk of digoxin toxicity because low potassium levels enhance digoxin's effects on the myocardium. A client is prescribed metoprolol, low pressor, for hypertension. The nurse should monitor the client for potential side effects. A. Bradycardia. B. Tachycardia. C. Hyperglycemia. D. Hyperkalemia. It's A. Bradycardia. Metoprolol is a beta blocker that can cause bradycardia due to its action of decreasing heart rate. A client receiving clopidogrel, Plavix, should be monitored for which of the following? A. Increased clotting time. B. Increased white blood cell count. C. Hyperglycemia. D. Decreased platelet count. It's D. Decreased platelet count. Clopidogrel inhibits platelet aggregation, and the client should be monitored for thrombocytopenia. A client with tuberculosis is prescribed isoniazid. The nurse should teach the client to monitor for which side effects? A. Jaundice. B. Weight gain. C. Polyuria. D. Dry cough. It's A. Jaundice. Isoniazid can cause liver toxicity, and jaundice is a sign of hepatic dysfunction. A nurse is providing discharge teaching to a client prescribed levodopa carbidopa, Sinemet, for Parkinson's disease. Which statement by the client indicates a need for further teaching? A. I will take my medication with a high-protein meal. B. I should get up slowly to prevent dizziness. C. This medication may cause my urine to darken. D. I should notify my doctor if I experience involuntary movements. It's A. I will take my medication with a high-protein meal. High-protein meals can interfere with the absorption of levodopa, reducing its effectiveness. A client is prescribed nitroglycerin transdermal patches for angina. The nurse should teach the client to A. Remove the patch at bedtime. B. Apply the patch to the same site daily. C. Use the patch only during episodes of chest pain. D. Avoid using the patch during exercise. It's A. Remove the patch at bedtime. Removing the patch at bedtime helps prevent the development of tolerance to nitroglycerin. A client is receiving gentamicin for a bacterial infection. The nurse should monitor the client for which of the following? A. Hypoglycemia. B. Hypernatremia. C. Ototoxicity. D. Diarrhea. It's C. Ototoxicity. Gentamicin is an aminoglycoside that can cause ototoxicity, leading to hearing loss or balance issues. A client taking oral contraceptives reports missing 2 doses. The nurse should advise the client to A. Stop taking the pills immediately and start a new pack. B. Take the missed pills immediately, then resume the normal schedule. C. Wait until the next cycle to resume taking the pills. D. Continue taking the pills as scheduled and use a backup method of contraception. It's D. Continue taking the pills as scheduled and use a backup method of contraception. Missing 2 doses of oral contraceptives increases the risk of pregnancy, and a backup method should be used for the remainder of the cycle. A client with rheumatoid arthritis is prescribed methotrexate. The nurse should monitor the client for which of the following? A. Hypertension. B. Liver function abnormalities. C. Hyperglycemia. D. Hypokalemia. It's B. Liver function abnormalities. Methotrexate can cause hepatotoxicity, so liver function tests should be regularly monitored. A client is prescribed fluoxetine, Prozac, for depression. Which of the following should the nurse include in the client's education? A. You may feel better immediately after starting this medication. B. Avoid taking this medication with grapefruit juice. C. You can stop the medication once you feel better. D. This medication may take several weeks to take effect. It's D. This medication may take several weeks to take effect. Fluoxetine, an SSRI, typically takes several weeks to reach its full therapeutic effect. A client is prescribed hydrochlorothiazide for hypertension. Which potential side effects should the nurse monitor? A. Hypercalcemia. B. Hypokalemia. C. Hyperkalemia. D. Hypermagnesemia. It's B. Hypokalemia. Hydrochlorothiazide is a thiazide diuretic that can cause potassium loss, leading to hypokalemia. Is prescribed enoxaparin, Lovenox. The nurse should teach the client to A. Monitor blood glucose levels daily. B. Avoid aspirin and other NSAIDs. C. Take the medication on an empty stomach. D. Limit fluid intake. It's B. Avoid aspirin and other NSAIDs. Aspirin and NSAIDs can increase the risk of bleeding when taken with enoxaparin, an anticoagulant. A client receiving chemotherapy is prescribed ondansetron, Zofran. The nurse should monitor the client for A. Headache, B. Bradycardia, C. Diarrhea, D. Hyperkalemia. It's A. Headache. Headache is a common side effect of ondansetron, an antiemetic used to prevent nausea and vomiting. A client is taking allopurinol for chronic gout. The nurse should teach the client to A. Limit fluid intake. B. Take the medication with food. C. Avoid dairy products. D. Avoid alcohol. It's D. Avoid alcohol. Alcohol can increase uric acid levels and decrease the effectiveness of allopurinol. A client with chronic obstructive pulmonary disease, COPD, is prescribed ipratropium bromide, Atrovent. Which side effects should the nurse monitor for? A. Dry mouth. B. Tachycardia. C. Diarrhea. D. Hypotension. It's A. Dry mouth. Ipratropium bromide, an anticholinergic bronchodilator, can cause dry mouth as a common side effect. A client is prescribed ciprofloxacin for a urinary tract infection. The nurse should instruct the client to A. Avoid dairy products while taking this medication. B. Take the medication with antacids. C. Limit fluid intake. D. Take the medication on an empty stomach. It's A. Avoid dairy products while taking this medication. Dairy products can interfere with the absorption of ciprofloxacin, reducing its effectiveness. A client with atrial fibrillation is prescribed warfarin. The nurse should teach the client to A. Monitor for signs of bleeding. B. Take the medication with vitamin K-rich foods. C. Avoid all green vegetables. D. Double the dose if a dose is missed. It's A. Monitor for signs of bleeding. Warfarin increases the risk of bleeding, so the client should be taught to monitor for and report any signs of bleeding. A client is receiving prednisone for an acute exacerbation of asthma. The nurse should monitor the client for which of the following side effects? A. Hypoglycemia. B. Hypercalcemia. C. Hyperglycemia. D. Hypotension. It's C. Hyperglycemia. Corticosteroids like prednisone can increase blood glucose levels, leading to hyperglycemia. A client is prescribed sildenafil, Viagra, for erectile dysfunction. Which of the following conditions is contraindicated for this medication? A. Diabetes mellitus. B. Hypertension. C. Benign prostatic hyperplasia. D. Angina treated with nitrates. It's D. Angina treated with nitrates. Sildenafil is contraindicated in clients taking nitrates because the combination can cause a dangerous drop in blood pressure. A nurse is administering a flu vaccine to a client. The nurse should explain that the vaccine is contraindicated in clients with A. Shellfish allergy. B. Egg allergy. C. Penicillin allergy. D. Sulfa allergy. It's B. Egg allergy. Some flu vaccines are made using eggs, and clients with severe egg allergies should avoid these vaccines. A client with bipolar disorder is prescribed valproic acid. The nurse should monitor which of the following laboratory values? A. Platelet count. B. Sodium levels. C. Blood glucose. D. Creatinine levels. It's A. Platelet count. Valproic acid can cause thrombocytopenia, so the platelet count should be regularly monitored. A client with a severe allergic reaction is prescribed epinephrine. The nurse should teach the client that the most common side effect of this medication is A. Bradycardia, B. Hypotension, C. Hypoglycemia, D. Tachycardia. It's D. Tachycardia. Epinephrine can cause tachycardia due to its stimulatory effects on the heart. A client is prescribed carbamazepine Tegretol for seizure control. Which adverse effects should the nurse monitor for? A. Agranulocytosis, B. Hypertension, C. Hypoglycemia, D. Hyperkalemia. It's A. Agranulocytosis. Carbamazepine can cause agranulocytosis, a serious condition where white blood cell counts drop dangerously low, increasing infection risk. A client with chronic pain is prescribed acetaminophen, Tylenol. The nurse should teach the client to avoid which of the following to prevent toxicity? A. Alcohol, B. Dairy products, C. High-protein foods, D. Vitamin C. It's A. Alcohol. Alcohol can increase the risk of liver damage when taken with acetaminophen. A client is prescribed levetiracetam, Keppra, for epilepsy. The nurse should monitor the client for which of the following side effects? A. Mood changes, B. Hypertension, C. Hypercalcemia, D. Weight gain. It's A. Mood changes. Levetiracetam can cause mood changes, including depression and irritability. A client is receiving intravenous vancomycin. The nurse should infuse the medication slowly to prevent A. Hypertension, B. Hypoglycemia, C. Red man syndrome, D. Hypernatremia. It's C. Red man syndrome. Rapid infusion of vancomycin can cause red man syndrome, a histamine reaction characterized by flushing and rash. A client taking clozapine, Clozaril, should have regular monitoring of A. blood glucose levels, B. liver function tests, C. kidney function tests, D. white blood cell count. It's D. white blood cell count. Clozapine can cause agranulocytosis, so regular monitoring of the white blood cell count is essential. A client with hyperlipidemia is prescribed simvastatin, Zocor. The nurse should teach the client to report which of the following symptoms: A. Constipation, B. Muscle pain, C. Headache, D. Dizziness. It's B. Muscle pain. Muscle pain can be a sign of rhabdomyolysis, a serious side effect of statins. A client is prescribed propylthiouracil, PTU, for hyperthyroidism. Which of the following side effects should the nurse monitor for? A. Sore throat, B. Weight gain, C. Hyperglycemia, D. Hypertension. It's A. Sore throat. A sore throat can indicate agranulocytosis, a rare but serious side effect of PTU. A client is prescribed sumatriptan, Imitrex, for migraine headaches. The nurse should teach the client to avoid A. Caffeine, B. Alcohol, C. Tyramine-containing foods, D. Dairy products. It's B. Alcohol. Alcohol can trigger migraines and may interfere with the effectiveness of sumatriptan. A client taking digoxin has a serum digoxin level of 2.5 ng/ml. The nurse should A. Administer the next dose as scheduled. B. Administer an antidote for digoxin toxicity. C. Hold the next dose and notify the healthcare provider. D. Increase the dose to achieve therapeutic levels. It's C. Hold the next dose and notify the healthcare provider. A digoxin level of 2.5 ng/ml is above the therapeutic range, 0.5, 2.0 ng/ml, and indicates toxicity. A client with type 1 diabetes is prescribed insulin glargine, Lantus. The nurse should instruct the client that this insulin, A. has no peak action time, B. should be taken with meals, C. can be mixed with other insulins, D. should be taken only when blood sugar is high. It's A. has no peak action time. Insulin glargine is a long-acting insulin that provides a steady release of insulin with no pronounced peak. A client with peptic ulcer disease is prescribed omeprazole, Prilosec. The nurse should instruct the client to take the medication. A. After meals. B. With meals. C. At bedtime. D. Before meals. It's D. Before meals. Omeprazole is a proton pump inhibitor that should be taken before meals to reduce stomach acid production effectively. A client with asthma is prescribed Montelukast, singular. The nurse should inform the client that this medication is used to A. Prevent asthma symptoms. B. Treat acute asthma attacks. C. Replace inhaled corticosteroids. D. Relieve acute bronchospasm. It's A. Prevent asthma symptoms. Montelukast is a leukotriene receptor antagonist used as a maintenance therapy to prevent asthma symptoms. A client is prescribed atorvastatin, Lipitor. The nurse should advise the client to take this medication. A. In the evening. B. In the morning. C. At noon. D. With meals. It's A. In the evening. Statins are most effective when taken in the evening because cholesterol synthesis in the liver is highest at night. A client is prescribed amiodarone, Cordarone, for atrial fibrillation. The nurse should instruct the client to report which of the following symptoms. A. Cough and shortness of breath. B. Weight loss. C. Increased appetite. D. Muscle pain. It's A. Cough and shortness of breath. Amiodarone can cause pulmonary toxicity, which may present as a cough, shortness of breath, or chest pain. A client with chronic kidney disease is prescribed epoetin alpha, Epigen. The nurse should monitor the client for potential side effects. A. Hypotension. B. Hyperkalemia. C. Hypertension. D. Hypokalemia. It's C. Hypertension. Epoetin alpha can increase blood pressure, especially in clients with chronic kidney disease. A client is prescribed alendronate, Fosamax, for osteoporosis. The nurse should instruct the client to A. Take the medication with food. B. Take the medication at bedtime. C. Avoid all dairy products. D. Remain upright for at least 30 minutes after taking it. It's D. Remain upright for at least 30 minutes after taking it. Alendronate can cause esophageal irritation, so the client should remain upright to prevent reflux and esophageal injury. A client is prescribed methyldopa aldomet for hypertension. The nurse should inform the client of the common side effects. A. Hyperglycemia. B. Dry mouth. C. Insomnia. D. Hypokalemia. It's B. Dry mouth. Methyldopa, an alpha-2 agonist, can cause dry mouth as a common side effect. A client is prescribed spironolactone, aldactone, for heart failure. The nurse should monitor the client for which of the following? A. Hypocalcemia. B. Hyperkalemia. C. Hypernatremia. D. Hypokalemia. It's B. Hyperkalemia. Spironolactone is a potassium-sparing diuretic, which can lead to an increase in serum potassium levels. A client is prescribed nitrofurantoin, Macrobid, for a urinary tract infection. The nurse should instruct the client to report which of the following symptoms: A. Cough and shortness of breath. B. Muscle pain. C. Dark-colored urine. D. Nausea. It's A. Cough and shortness of breath. Nitrofurantoin can cause pulmonary reactions, including cough, shortness of breath, and chest pain. A client is prescribed hydrocodone, acetaminophen, Vicodin, for pain management. The nurse should monitor the client for which of the following side effects? A. Diarrhea. B. Hypertension. C. Hypoglycemia. D. Sedation. It's D. Sedation. Hydrocodone is an opioid analgesic that can cause CNS depression, leading to sedation. A client with hyperthyroidism is prescribed propylthiouracil, PTU. The nurse should monitor the client for which adverse effect? A. Leukopenia. B. Tachycardia. C. Hyperglycemia. D. Hypertension. It's A. Leukopenia. PTU can cause bone marrow suppression, leading to leukopenia, a decreased white blood cell count. A client is prescribed furosemide, Lasix, for edema. The nurse should monitor the client for which of the following electrolyte imbalances: A. Hypokalemia. B. Hypernatremia. C. Hypercalcemia. D. Hyperkalemia? It's A. Hypokalemia. Furosemide is a loop diuretic that can cause potassium loss, leading to hypokalemia. A client is taking levothyroxine, Synthroid, for hypothyroidism. The nurse should instruct the client to take the medication. A. On an empty stomach in the morning. B. With meals. C. At bedtime. D. With a glass of milk. It's A. On an empty stomach in the morning. Levothyroxine is best absorbed on an empty stomach, ideally 30 minutes to 1 hour before breakfast. A client with chronic pain is prescribed tramadol, Ultram. The nurse should monitor the client for which of the following side effects? A. Hypertension. B. Hypoglycemia. C. Seizures. D. Tachycardia. It's C. Seizures. Tramadol lowers the seizure threshold and can increase the risk of seizures, especially in clients with a history of seizures. A client is prescribed phenytoin, Dilantin, for seizure control. The nurse should teach the client to A. Take the medication with grapefruit juice. B. Stop the medication once seizures are controlled. C. Take the medication only during a seizure. D. Brush and floss regularly to prevent gingival hyperplasia. It's D. Brush and floss regularly to prevent gingival hyperplasia. Phenytoin can cause gingival hyperplasia, so good oral hygiene is essential. A client with bipolar disorder is prescribed lithium. The nurse should monitor which of the following electrolyte levels: A. Potassium. B. Sodium. C. Calcium. D. Magnesium. It's B. Sodium. Sodium levels can affect lithium levels. Low sodium can increase the risk of lithium toxicity. A client with a fungal infection is prescribed fluconazole, Diflucan. The nurse should instruct the client to A. Avoid alcohol. B. Take the medication with a full meal. C. Avoid dairy products. D. Limit fluid intake. It's A. Avoid alcohol. Alcohol can increase the risk of liver toxicity when taken with antifungal medications like fluconazole. A client is prescribed amitriptyline for depression. The nurse should teach the client that this medication may cause A. Insomnia. B. Weight loss. C. Diarrhea. D. Dry mouth. It's D. Dry mouth. Amitriptyline, a tricyclic antidepressant, can cause anticholinergic side effects like dry mouth. A client is prescribed insulin Lispro, Humalog, for type 1 diabetes. The nurse should instruct the client to A. Take the insulin immediately before meals. B. Take the insulin 30 minutes before meals. C. Take the insulin at bedtime. D. Take the insulin only when blood sugar is low. It's A. Take the insulin immediately before meals. Insulin Lispro is a rapid-acting insulin that should be taken immediately before or with meals to manage postprandial blood glucose levels. A client with schizophrenia is prescribed olanzapine, Zyprexa. The nurse should monitor the client for which potential side effect? A. Hyperglycemia. B. Hypotension. C. Bradycardia. D. Hyperkalemia. It's A. Hyperglycemia. Olanzapine can cause metabolic side effects, including hyperglycemia and weight gain. A client is prescribed vancomycin for a serious bacterial infection. The nurse should monitor which of the following during administration? A. Serum creatinine levels. B. Blood glucose levels. C. Platelet count. D. Sodium levels. It's A. Serum creatinine levels. Vancomycin can be nephrotoxic, so kidney function should be monitored. A client is prescribed methylphenidate, Ritalin, for ADHD. The nurse should instruct the client to A. Take the medication at bedtime. B. Take the medication with food. C. Avoid caffeine. D. Increase fluid intake. It's C. Avoid caffeine. Methylphenidate is a stimulant, and combining it with caffeine can increase the risk of side effects like nervousness and insomnia. A client is prescribed lisinopril, Zestril, for hypertension. The nurse should monitor the client for which of the following side effects? A. Hypocalcemia. B. Hyperglycemia. C. Hypokalemia. D. Hyperkalemia. It's D. Hyperkalemia. lisinopril, an ACE inhibitor, can cause an increase in potassium levels, leading to hyperkalemia. A client with an autoimmune disorder is prescribed cyclosporin, Neoral. The nurse should monitor the client for which of the following adverse effects? A. Hypotension. B. Nephrotoxicity. C. Hypernatremia. D. Hypercalcemia. It's B. Nephrotoxicity. Cyclosporine can cause nephrotoxicity, so kidney function should be closely monitored. A client with depression is prescribed sertraline, Zoloft. The nurse should instruct the client to report which of the following symptoms? A. Increased appetite. B. Drowsiness. C. Weight gain. D. Suicidal thoughts. It's D. Suicidal thoughts. Sertraline and SSRI can increase the risk of suicidal thoughts, especially when treatment is initiated or the dose is changed. A client with hypertension is prescribed clonidine, Catapres. The nurse should monitor the client for which of the following side effects? A. Diarrhea. B. Bradycardia. C. Hyperglycemia. D. Insomnia. It's B. Bradycardia. Clonidine is an alpha-2 agonist that can cause a decrease in heart rate, leading to bradycardia. A client is prescribed prednisone for rheumatoid arthritis. The nurse should instruct the client to A. Take the medication on an empty stomach. B. Take the medication with food. C. Take the medication in the evening. D. Avoid dairy products. It's B. Take the medication with food. Prednisone can cause gastrointestinal irritation, so it should be taken with food to reduce this risk. A client is prescribed enoxaparin, Lovenox, post-operatively. The nurse should monitor the client for which of the following complications? A. Thrombocytopenia. B. Hyperkalemia. C. Hypertension. D. Hyperglycemia. It's A. Thrombocytopenia. Enoxaparin can cause a decrease in platelet count, leading to thrombocytopenia. A client is prescribed losartan, Cozar, for hypertension. The nurse should instruct the client to avoid which of the following: A. Grapefruit juice. B. Dairy products. C. High-protein foods. D. Potassium supplements. It's D. Potassium supplements. Losartan, an ARB, can increase potassium levels, so the client should avoid potassium supplements to prevent hyperkalemia. A client is prescribed metronidazole, Flagyl, for a bacterial infection. The nurse should instruct the client to avoid which of the following during treatment? A. Alcohol. B. Dairy products. C. Caffeine. D. High-fat foods. It's A. Alcohol. Metronidazole can cause a disulfiram-like reaction when taken with alcohol, leading to severe nausea, vomiting, and headache. A client with heart failure is prescribed carvedilol, Coreg. The nurse should monitor the client for which of the following side effects? A. Bradycardia. B. Hypertension. C. Hyperglycemia. D. Hyperkalemia. It's A. Bradycardia. Carvedilol is a beta blocker that can slow the heart rate, leading to bradycardia. A client is prescribed tadalafil, Cialis, for erectile dysfunction. The nurse should instruct the client to avoid taking this medication with A. Nitroglycerin. B. Antihistamines. C. Antacids. D. Aspirin. It's A. Nitroglycerin. Tadalafil can cause a significant drop in blood pressure if taken with nitrates like nitroglycerin. A client is prescribed doxycycline for an infection. The nurse should instruct the client to avoid which of the following? A. Caffeine. B. High-protein foods. C. Dairy products. D. Vitamin C. It's C. Dairy products. Dairy products can bind to doxycycline and reduce its absorption, making the medication less effective. A client with anxiety is prescribed buspirone, Buspar. The nurse should instruct the client that this medication A. May cause sedation. B. Should be taken on an empty stomach. C. Should be taken only as needed. D. May take several weeks to achieve full effect. It's D. May take several weeks to achieve full effect. Buspirone is not a fast-acting anxiolytic and may take several weeks for the full therapeutic effect to be achieved. A client is prescribed finasteride, Proscar, for benign prostatic hyperplasia. BPH. The nurse should inform the client that this medication, A, should be taken at bedtime, B, can cause impotence, C, can increase hair growth, D, should be avoided in clients with hypertension. It's B, can cause impotence. Finasteride can cause sexual side effects, including decreased libido and impotence. A client with gout is prescribed allopurinol, Xyloprim. The nurse should instruct the client to A, increase fluid intake, B, limit vitamin C intake, C, avoid dairy products, D, take the medication with a high-protein meal. It's A, increase fluid intake. Increased fluid intake helps prevent the formation of kidney stones, a possible side effect of allopurinol. A client is prescribed warfarin, Coumadin, for atrial fibrillation. The nurse should instruct the client to monitor which of the following regularly? A, blood pressure, B, blood glucose levels, C, platelet count, D, INR, international normalized ratio. It's D, INR, international normalized ratio. The INR is used to monitor the effectiveness of warfarin therapy and ensure that the client remains within the therapeutic range. A client with schizophrenia is prescribed risperidone, Risperdal. The nurse should monitor the client for which of the following side effects? A, weight gain, B, hypertension, C, hypercalcemia, D, bradycardia. It's A, weight gain. Risperidone can cause significant weight gain and metabolic changes, which should be monitored. A client is prescribed methotrexate for rheumatoid arthritis. The nurse should instruct the client to A, increase fluid intake, B, avoid folic acid supplements, C, take the medication with dairy products, D, limit exposure to sunlight. It's A, increase fluid intake. Methotrexate can cause renal toxicity, so increasing fluid intake can help prevent kidney damage. A client with chronic obstructive pulmonary disease, COPD, is prescribed theophylline. The nurse should monitor the client for which of the following side effects? A, tachycardia, B, hypotension, C, hyperglycemia, D, hypokalemia. It's A, tachycardia. Theophylline can cause CNS stimulation, leading to side effects like tachycardia, anxiety, and tremors. A client is prescribed metformin, glucophage, for type 2 diabetes. The nurse should monitor the client for which of the following side effects? A, hypercalcemia, B, hypertension, C, lactic acidosis, D, hypokalemia. It's C, lactic acidosis. Metformin can rarely cause lactic acidosis, a serious condition that requires immediate medical attention. A client is prescribed alprazolam, Xanax, for anxiety. The nurse should instruct the client to A, take the medication with a full meal, B, take the medication only in the morning, C, increase fluid intake, D, avoid operating heavy machinery. It's D, avoid operating heavy machinery. Alprazolam can cause drowsiness and sedation, so clients should avoid activities requiring alertness until they know how the medication affects them. A client is prescribed sulfamethoxazole trimethoprim, Bactrim, for a urinary tract infection. The nurse should instruct the client to A, increase fluid intake, B, limit sun exposure, C, take the medication with food, D, avoid dairy products. It's B, limit sun exposure. Sulfamethoxazole trimethoprim can cause photosensitivity, so clients should limit sun exposure to avoid sunburn. A client with Parkinson's disease is prescribed levodopa-carbidopa, Sinemet. The nurse should monitor the client for which of the following side effects? A, dyskinesia, B, hyperglycemia, C, hypertension, D, hypokalemia. It's A, dyskinesia. Long-term use of levodopa-carbidopa can cause dyskinesia, which are involuntary movements. A client with a peptic ulcer is prescribed sucralfate, Carafate. The nurse should instruct the client to take the medication A, with meals, B, at bedtime, C, on an empty stomach, D, with antacids. It's C, on an empty stomach. Sucralfate forms a protective barrier over the ulcer when taken on an empty stomach. A client with asthma is prescribed fluticasone, Flovent. The nurse should instruct the client to A. Avoid dairy products. B. Avoid dairy products. C. Use the inhaler only during an asthma attack. D. Rinse the mouth after each use. It's D. Rinse the mouth after each use. Rinsing the mouth after using a corticosteroid inhaler like fluticasone helps prevent oral thrush, a common side effect. A client is prescribed methadone for opioid dependence. The nurse should monitor the client for which of the following side effects? A. Hyperglycemia. B. Respiratory depression. C. Hypertension. D. Diarrhea. It's B. Respiratory depression. Methadone is a potent opioid that can cause significant respiratory depression, especially in high doses or in combination with other CNS depressants. A client is prescribed atorvastatin, Lipitor, for hyperlipidemia. The nurse should monitor the client for which of the following adverse effects? A. Hypertension. B. Hypoglycemia. C. Hyperkalemia. D. Muscle pain. It's D. Muscle pain. Atorvastatin can cause myopathy, which may present as muscle pain or weakness. In rare cases, it can lead to rhabdomyolysis. A client is prescribed digoxin, Lanoxin, for heart failure. The nurse should monitor the client for which of the following signs of toxicity? A. Hypertension. B. Hypokalemia. C. Hyperglycemia. D. Bradycardia. It's C. Hyperglycemia. Digoxin toxicity can cause bradycardia, visual disturbances, nausea, and confusion. Monitoring heart rate is essential. Great job completing the NCLEX Pharmacology Trivia Challenge. Keep studying, stay sharp, and you're one step closer to mastering pharmacology and excelling on your exam.